Hello, today we'll be talking about a variety of health-related issues in relation to intellectual and developmental disabilities, also known as IDD. These are secondary conditions, causes of mortality, aging with IDD, challenging behaviors, and abuse among those with IDD. Secondary health conditions are any additional disease, syndrome, or disorder that result from the primary disability, like autism spectrum disorder, Down syndrome, or cerebral palsy. Secondary health conditions can increase the severity of the primary condition. Examples of secondary conditions include medical complications like pressure sores for people in wheelchairs and cardiovascular problems for those who may have spinal cord injuries, as well as mental health disorders and physical deconditioning. Additionally, abuse is more prevalent in individuals with IDD at a rate of 4 to 10 times than those without IDD. One kind of abuse that is particularly prevalent is sexual abuse. In a study published in the Journal of Disability Research, 15 out of 18 parents and caregivers describe sexual abuse experienced by an individual with IDD. Signs and symptoms of this abuse include decreased functioning in independent living, language, self-direction, physical development, and socialization. And additionally, occupations of play, work, home care, social enlightenment, engagement are helpful with working through intimate partner violence. Now we're moving on to aging with IDD. According to the official publication of the College of Family Physicians of Canada, those with mild IDD live about the same amount of time as those without IDD, while moderate to severe cases of IDD live about 50 to 60 years. People with IDD experience the same age-related conditions, but they often go undiagnosed. There's an increased rate of Alzheimer's disease due to genetics in patients with Down syndrome. Needs that can be addressed in these patients are taking a developmental approach, helping people with IDD make decisions themselves, and acknowledging the vulnerability that aging people with IDD face.
Now we'll be talking about the behavioral difficulties that those with IDD face. Individuals with intellectual and developmental disabilities experience higher rates of health problems compared to those of the rest of the population. The reason for the increased rate is due to the communication barriers between the provider and the patient, the lack of knowledge the provider may have on the disability that the patient presents with, and the behavioral challenges that can inhibit correct treatment or cause other conditions. Today we'll be discussing the challenges in behaviors patients exhibit. Challenging behaviors are considered abnormal behaviors such as aggression, tantrums, or self-injury that may harm those or the others around them and themselves. This behavior can stem from unmet needs, pain, sensory sensitivities, or even communication difficulties. To the patient, the behavior they present is often a form of communication, trying to express their discomfort or frustration. However, these behaviors can lead to undiagnosed problems or even lack of care and a high mortality rate. Let's start with some common health conditions and behavioral manifestations. A common infection seen in patients with IDD is otitis media, or more commonly known as the ear infection. As we all know, ear infections are incredibly uncomfortable. For a child or adult with IDD, they may engage in self-injurious behavior such as ear poking or itching to relieve the discomfort. However, they continue the self-injurious behavior after the infection, and the self-continuous behavior after the infection can lead to further damage to the eardrum or increased risk of another ear infection. As stated before, patients may have outbursts that can harm themselves or others, impeding their treatment. An example of this is a patient with constipation or sleep disturbances increasing their frustration. In this circumstance, the patient may be grabbing their stomachs in areas of pain to indicate their discomfort or exhibiting increased crying or screaming. Although this is a form of communication for them as a provider without proper background on the patient's IDD, this behavior may impede their treatment. This leads us to the final part of how we can make the visit more comfortable for patients with IDD and help their behavior. First, the provider should gather a thorough medical history. They can present more visuals during the visit that will make communication easier for the patient and allow for a familiar caregiver to be there to aid the patient. Some patients may have sensory issues, which the provider should adjust the clinical environment by reducing light and sounds. During the exam, the provider should be giving the patient frequent breaks, which will decrease sensory input. Provide positive reinforcement for cooperative behavior as well. In situations and behavior outbursts, the provider should remain calm and try to negotiate with the patient. Along with this, the provider should collaborate with other professions to ensure the patient's needs and behaviors are being met and controlled.
I'm going to be discussing the gastropharyngeal reflux disease, otherwise known as GERD, for our section, specifically with patients with intellectual and developmental disabilities, otherwise known as IDD. The following information that I got a lot of this is from the Upper Gastrointestinal Disorders in Adult Patients with Intellectual and Developmental Disabilities by Curtis. In simple terms, GERD is basically known as a condition where the stomach contents, including the acid, flow back into the esophagus, leading to discomfort, irritation, and potentially serious complications. While GERD affects many people, it's a lot higher in individuals with IDD. It's around 50% compared to the 10 to 20% in the general population. The unique challenges these patients face make diagnosing and managing GERD particularly complex because of their disabilities. Diagnosing GERD in individuals with IDD, because it's hard because they cannot communicate their symptoms clearly. Instead of reporting typical symptoms like their heartburn, they can show signs such as increased irritability, aggression, or changes in eating habits. GERD's effect on speech and swallowing specifically is a consequence of GERD because GERD can cause chronic inflammation in the throat and esophagus. It leads to a couple different things, specifically looking at dysphagia, hoarseness or voice changes due to the acid damaging the vocal cords, increased saliva production and difficulty managing oral secretions, aversion to eating certain textures or food consistencies, which leads to nutritional deficits. And lastly, the complications of GERD in IDD patients, if left untreated, can lead to serious health risks, such as aspiration pneumonia, which is when acid or those food particles enter the lungs, causing infection, esophageal strictures, which are the narrowing of the esophagus due to prolonged acid exposure, Barrett's esophagus, which is a condition that increases the risk of esophageal cancer, and lastly, dental caries and erosion, which acid reflux can wear away the tooth canal, leading to increased dental problems. And managing GERD in patients with IDD requires a combination of lifestyle changes, dietary modifications, and medical treatments. We can specifically look at adjusting their dietary needs, their medication, their positioning strategies with how they eat, and their surgical options if they are severe cases. And overall, GERD is a significant concern in individuals with IDD because they present with those atypical symptoms, and it could lead to serious complications if not properly managed.
So now we're going to talk a little bit about the educational pamphlet we made, which is for health problems among individuals with intellectual disabilities. And this is mainly geared towards the caregivers of those with IDDs. So first we just started off with a basic and brief definition of what an intellectual disability is. So it's a condition that disrupts an individual's ability for living independently and limits intelligence. And the importance of this is because a lot of times people with IDDs tend to have more secondary health problems than the general population. So next we listed a couple of the different types of health problems within this population. So those can include seizure disorders, GI issues, communication difficulties, motor deficits, UTIs, dental problems, and hearing and vision impairments. And then on our back side of the pamphlet, we talked a little bit about some potential signs to look for. So these behavioral challenges can look like increased irritability, refusal to eat, changes in appetite, inappropriate behaviors, potential self-harm behaviors, difficulty falling asleep, and unexplained emotional outbursts. So these are all some potential signs for caregivers to look for. And then finally, we just had some brief key tips and takeaways. So our main thing to keep in mind is that behavior often serves a purpose. So oftentimes those with limited communication abilities indicate the presence of pain and discomfort through these challenging behaviors. So we noted that if you notice any sudden behavioral changes, it's always better to be safe than sorry and to seek medical advice immediately. Being proactive can make a huge impact.